To begin our session, I am going to read a land acknowledgement. So I think this is something important, especially for us here in Canada. I gratefully acknowledge the traditional, ancestral, and unceded territories of the Semiahmoo, Katzie, Coquitlam, Kwantlen, Kokite, and Tsawwassen First Nations, where I live, work, and play. And I am so grateful to be in this land and to be able to do what I do. Welcome all you amazing, amazing people who have come to this event today on February 9th, 2023. I'm Esther and I am the founder and CEO of Mind Myself, and it is my great pleasure to be here with you on this inaugural event. We are thrilled to be bringing this information to you and starting a conversation that many of us have maybe never had before. And so, first of all, I want to thank you. Time is precious, and you've chosen to join us today and spend the next 90 minutes of your time with us, either in person live here or later on the recording. Welcome. A quote I came across recently said, and I'm going to read it to get it right, but it's just so short and sweet. Aging is a privilege denied to many. I'm going to say that again. Aging is a privilege denied to many. So we're in the process of aging, and how do we celebrate it? And I'm convinced that today you are going to hear things, become aware of things that you can apply directly into your life and that are going to shift how you view aging and how you view yourself and being in your body today. And I have a couple of thank yous that are super important to me. I believe my mom is online watching this, so hi Mom, glad you're here. And I want to thank two people who were at the beginning of this journey and without whom I probably wouldn't have started and wouldn't be here today, Amy Lippett and Graham Snowfield. And I want to thank my mentor, Carolyn Samney, one of my few mentors who make a huge difference in my life, and my team. This is not a solo endeavor. It is not possible to do all this by myself. So from the bottom of my heart, I thank Wendy Rotluff and Jeff Gosson, and my partner, who is my partner in all things, Bill Chalmers. Thank you. And no event like this would be complete without reading a disclaimer. So I'm just going to get to it because we have to do this. All the information and advice from Mind Myself and the practitioners is for general education purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information here and on the Mind Myself website should not be used for self-diagnosis or self-treatment of medical conditions. It is always recommended that you consult with a doctor or other qualified healthcare practitioner for individualized medical advice on specific medical issues. Okay, we've got that out of the way. So the Mind Myself vision really, really, truly is about cultivating unity in these times of divisiveness, and also to help you feel seen and heard and supported in your health journey as you learn to become your own best health advocate. So again, all the people who continue to join, welcome. We are so glad you're here with us. We are together going to create a safe space to have an amazing discussion about really important things for women. And Dr. Neelima recently shared with us, she's one of our practitioners on the call today, she recently shared with us a statistic that there will be, get this, 1 billion women entering menopause in the next decade. 1 billion women. That's 1/8 of the population. And by my count, that's a whole lot of global warming that's going to happen that we're not even talking about yet. So let's get to it, I say. So, beautiful practitioners, I would love for you to take a moment and and to introduce yourselves to this fabulous group of people, your credentials, why you love what you do, as it relates specifically to women and the topic that we're going to talk about today, which is what the hormone is happening to me and what can I do about it. Dr. Neelima, start us
Hi,
off, please.
Asta. Happy birthday, first of all. And thank you so much for creating Mind Myself and having this platform here with all of these wonderful, wonderful people who have come to learn about hormones. I'm Dr. Neelima Deshpande. I'm a gynecologist by profession. I'm based currently in Pune in India, and I have 3 decades of international experience in women's healthcare. My expertise is in menopause, sexual health, and urinary incontinence. I'm also a wild fit coach, and I've also trained myself, to keep fit in Maipadam and Karlakattai, which are ancient Indian martial fitness arts. And I've qualified in India and the UK. I am a fellow of the Royal College of Obstetricians and Gynecologists and a fellow of the Faculty of Sexual and Reproductive Healthcare. And I love hormones because that's what I did for myself. As I went through menopause and through debilitating fibromyalgia, chronic pain, depression, and anxiety, I realized that even as a gynecologist, I didn't know enough of what was happening to my body as I navigated menopause and all of these horrible chronic pain conditions. And it wasn't until I did WildFit, and it wasn't until I started studying myself and the hormones going through me that I realized how important it is that women actually get a grip on their health and start planning for the years after menopause, because it's a long time before you're going to die. Every year you live, you're going to live longer. That's why I'm passionate about menopause and hormones.
Amazing. Thank you, Neelima. Jetta, if you could tell us about yourself, please.
Happy birthday, Esther.
Thank you.
I'm a doctor of traditional Chinese medicine in Vancouver, Canada, and I practice Chinese herbology and acupuncture. I have a wellness center. It's a women's health center, and I've been practicing for 20 years, and over the years, I've done a lot of work with thyroid hormones and reproductive health. Whether people are trying to get pregnant or not, there's a lot going on with women at all ages. And then I work with a lot of women going through menopause, and then just even in later years with some of the things that happen that are a result of hormone changes and aging and those kinds of things. I myself have a thyroid issue, and I use lots of different types of medicine and different lifestyle habits to help myself with it. I also just turned 50, so I'll be there's a lot of things that we learn over the years in healthcare and just by treating other people. And I know there's a lot of women that need help out there. In Canada, we don't have a lot of support through allopathic medicine, so that's kind of where I come in, and that's been a really great passion for me.
Thank you, Jetta. And Ariel, tell us about yourself, please.
Hi, Esther. Happiest of birthdays to you. It's such a pleasure to be here and to see everyone as I'm going through all the screens. So I am a registered holistic nutritionist and a wellness coach, and I practice energy medicine as well. And I combine all of those things together mainly to coach emotional eaters who are struggling with low self-esteem and an inability to overcome their snacking, to help them discover how to really love themselves and trust themselves again. I do this through a lot of mindful self-empowerment because it's never really about the food. Ultimately, it's around our behaviors and the thoughts and the feelings that trigger those behaviors. So I love getting to the root of those issues with my clients, which I do on a one-to-one basis, as well as in my membership groups and in the virtual programs that I have created. I met many of you who are here today through WildFit, which is also a phenomenal program. And I just love that it gets down to what we're here today to discuss, which is many people either don't talk about menopause at all because it's a very taboo topic, or we're so confused because there's so much information out there. So I'm so happy to get here to get down to simplifying it with all of you. I have not gone through menopause. However, I was diagnosed with Sheehan syndrome, which affects the pituitary gland. So I got a very intense crash course into my endocrine system basically shutting itself down. So I had to restructure my body from the ground up, and I'm very happy to say that I am, for the most part, thriving with that and have found ways around hormone replacement therapy and so on. So I'm happy to be here today to share some of that with you.
Wow, let's give our wonderful practitioners a round of applause. This is how deaf people clap. So this is how we have adopted it in our circles too. Thank you. What powerhouse women we have here. Oh my gosh, amazing. Well, let's jump into the conversation. And I want to refer to the chat as well. Please feel free to interact. I'm not going to be able to track the whole thing while this event is going on, but I promise you, I will be reading the whole thing after. So we saved it and I will see all your comments. So please engage, tell us where you're from and what decade of life you're in and where you heard about this event. And of course, if you have questions, whether we answer them today or not, I will look at them all and perhaps we can answer them in the next event. Let's dive into this amazing conversation. And I would like Ariel to start us off. What are the most common questions that women come to you with to start?
Okay, so because my scope is largely to do with nutrition, most of the women that come to see me are complaining that they've started to gain a lot of weight, usually around their middle, and no matter what they are doing or how they're trying to force their body to release that fat, it's just not happening. I also talk to a lot of women who experience an increase in cravings and changes in their eating behavior that have a lot to do with stress and with mood swings and fatigue. So they want support in changing those behaviors. I also see a lot of very active women who are becoming aware of cellulite and loose skin that's appearing on their body. They've always been very fit and healthy, and now this change is happening and they're not quite sure what to do with it. And women as well who, because there's so many symptoms that can be experienced that have to do not only with menopause, but could be a large variety of different illnesses or diseases in the body. They're really just looking for some certainty and support in what direction to move in and how to help themselves from home and in their own kitchens with these changes.
Thank you, Ariel. Neelima, what do women come to you with first?
Whole range of problems. Like Ariel said, many of them come with problems with obesity, but a lot of them also come with complaints relating to diabetes, high blood pressure. They have sexual symptoms, loss of libido, vaginal dryness, incontinence, poor, lax pelvic floor. So the first appearance of prolapse maybe. Many of them complain of really, really painful sex because the vagina's gone so dry. I also get menopausal women bringing their adolescent young girls who are now suffering with polycystic ovaries, or they may have daughters-in-law who have infertility. And I get to see this family, and generations of women, the grandmother who's got osteoporosis and is bordering on dementia. Then I see the 50-year-old, 60-year-old woman who's got diabetes, high blood pressure, menopausal symptoms. She's feeling depressed, maybe insomnia as well. And then I get to see the young daughter-in-law who's got infertility, and then the younger adolescent girl who's got polycystic ovaries. So this is the full range of hormone dysfunction that comes into my clinic quite regularly.
Wow, I can't even imagine. Jetta, what do people come to you with first around these issues?
I'm going to say all of the above. Weight, fertility, energy, sleep, huge. Body temperature dysregulation, that's a big one. Cold, either too cold, too hot, sweating at the wrong time. people are coming and saying, what's going on? Is this, don't feel like myself anymore. And I don't know if I'm going crazy. I'm irritable. My libido's down. I'm snapping at people. Maybe they deserve it. I don't know.
Well, let's not go there for this conversation, but yes, I'm sure there's some of that too.
Yeah, sometimes certain things we don't want to cure. I find that you covered it all. I mean, there's a lot of different things going on. So yeah.
And what excellent. So that opens the conversation with a wide range of issues. What are women most embarrassed about or hesitant to come to the table with when they're talking to you? And let's start with Neelima.
I think women hate to talk about their genitals. So anything relating to the vulva, the vagina, anything related to enjoying or not enjoying sex, anything related to incontinence, whether it's urinary or fecal incontinence, anything related to breasts. They just don't want to talk about it.
Huh. Anything different from either Jetta or Ariel? Or are you
not really? It's libido, vaginal dryness, even bowels and bladder habits.
And I would add as well, there's also just this sense, it's almost the same as what we went through at puberty. I hear clients expressing in different ways that they just feel unfamiliar with their bodies again. It's like they're not sure exactly what's happening, why it's happening, and we don't know exactly what to ask or how to ask those questions. It's like, I need support. I don't know exactly what to say. And that adds this secondary level of not necessarily embarrassment, but definitely maybe some shame coming up around that unfamiliarity with the body.
Absolutely. And shame, let's talk about that for a moment. And shame and blame, how do you put people at ease who are coming to see you? Jetta, what's the first thing that you do to help put people at ease?
People don't realize that other people are having the same problems and that they're not the only ones. And that even just saying, oh, some people will say, oh, TMI. I'm like, this is what I talk about all day and it's okay. And a lot of people are having these problems.
For sure. I remember I had an appointment with you once and I'm like, well, do you really want to hear this? And you went, hey, I talk about this all day long. Yes. Tell me, do open the conversation. Neelima, how do you put people at ease and maybe even say some of that to our people here in this room?
I have a little bit of an easy time because I'm a gynecologist, and my label says gynecologist and sex therapist, so they kind of know when they open the door they're going to get asked some stuff that they might not want to volunteer immediately. But I kind of say, put them at ease and ask them and build rapport and ask them about how their day is going, and then gradually say, well, what's the main thing you'd like to solve today? And then we gradually move to often women will start talking, oh, I've got a bit of discharge, I've got this, and then that leads on to the question, say, oh, okay, so when did the discharge start and how are you getting on with it? And maybe, then like Jetta says, start talking about well, how's things going on with your husband or your partner, because we have to be gender neutral nowadays. So we're going to talk about that, and then how's it going on, and then they start to open up gradually. And then when it comes to examining someone, and once I take consent to examine, when I'm closer to them, there's something about skin to skin contact that then allows someone to open up, and especially if I'm really gentle and kind, because that helps a lot. Then many times I'll have women cry on the couch and then start to come, and then everything bubbles out. So that's also something. So it is a whole lot of rapport building, and also creating a safe space where it can be discussed, and also making sure the environment is right. I always make sure that there's nobody, like in the clinic, making sure that there's privacy. I talk about confidentiality when I open up. I assure them that there's nobody else who's going to either read the notes or listen in. Even if there is a nurse or a medical student, sometimes without their consent, the client or the patient has has their say on whether they want those people in the room or not. And I allow whoever comes to me to lead the conversation, to guide me as to where they want to go with it. And sometimes I ask leading questions, but a lot of the questions are open questions about their relationships, about their bowel habits or bladder habits, their past medical conditions, what medicines they're taking. And maybe because we know that women who are taking antihypertensives or antidiabetics or lipid regulating drugs, they have side effects on sexual function. They have side effects on appetite. They have side effects on fat deposition. So all of these things sort of unfold as the history-taking process goes on.
Wow, that's a lot. And Ariel, I know you to be one of the gentlest people I've ever met. How do you put your clients at ease in talking about difficult conversations?
Thanks so much. As Neelima was sharing, it's really about empathy and compassion. I'm not in a clinical setting, but when I'm coaching my clients, there's something so empowering about knowing that you are in a space where you're not going to feel judged, or that you can just speak from your heart and what's going on without feeling like you are complaining. Because I think that there's this message that we receive that you just need to get on with it. You know, stop complaining. It happens to everyone, or don't talk about it. And we should just suck it up and move on. And so all of these people are suffering in silence and not really taking the proper time to process this shift, because it is such a big shift and transformation, and there's so much to it mentally and emotionally. And when we really can honor it and give it that time, how am I feeling about this? What can I look forward to in this? It's not just the negative stuff. There's so much positive that can happen. So many of, I'll just add, I was talking earlier from the nutritional side, but from the energetic medicine perspective, I see a lot of women who are coming to me and they're just trying to navigate these feelings of, I'm out of control, I'm at odds with myself, but also there's this deep grief and almost a panicked sensation that I'm becoming invisible. I'm now this invisible person. I'm now obsolete. I now, I've heard that, well, now I'm not entitled to have sexuality because I'm in this next stage of my life. And so if we're just going around and this is in the background without giving voice to it, it can grow into much bigger issues down the road. And so the sooner that we can get support with it, the better.
Oh, I love this. I just love this conversation. What I'm hearing is that this is something that's happening to all of us, and we can talk about this, and we should talk about this, and it's okay to talk about this, and we're not alone in this. So what are some things that all of us as women, and there are a few men on this call too, because hey, they're going through their own hormonal journey too, and there's safe men here. But what should all women know about hormones? What are some things that would be really important to share in this context? And let's start with Neelima, please.
I think women need to know that whether it's menopause, polycystic ovaries, the effects of hormones on their bodies, it's never a dead end. It's like, there's no need to despair. There's always a solution. There's always a way through. And maybe, women, they despair because, like me, they despair that they'll never lose the weight, or they despair they'll never get rid of the pain, or that the depression will never go, or this brain fog, that they're losing their minds because they can't seem to read a page of a novel unless, they can't remember it because they have to read it 3 or 4 times. And I want to reassure women that, yes, all of these changes can be hormonal. They can be related to your diet, can be related to your movement, can be related to your emotional state, your environment, the kind of people you live with, and toxins. And all of this affects how your hormones behave eventually, because the hormonal system in our body it is one system, but it is a very important system that affects all of the other systems. So I'm rambling a bit, but I just want to say that women need to feel reassured that they can help themselves navigate, whether it's menopause or any other hormonal issues, and that they needn't fear, that they should go to their doctors or their physicians or their counselors and be open about what they're experiencing. Because if they don't share and they don't talk about what they're experiencing, then the physician doesn't know. We don't have, even with physicians, we know from research that we don't have enough trained physicians to deal with these 1 billion women that are going to go through menopause. They're just not enough. So women need to empower themselves to be able to deal with these and get the help they need and be able to ask for it authoritatively and with assertiveness, because if they don't ask, they won't get it. That's really important.
Thank you, Neelima. Jetta, can you weigh in on this subject, please?
So coming from a Chinese medicine point of view, we're looking, I mean, hormone change is inevitable. Like you said, the ones who are lucky enough to age, right? And it's a normal process for hormones to start to change and your body to start to shift and to balance the balance of your body to start to shift. And some people have more struggles with it than others. And in Chinese medicine, we're not specifically looking at targeting hormones or glands per se. We're looking at how your body is functioning. I like to think of it as an ecosystem, and how is your body transitioning in this time, whether it is menopause or puberty or even my 30-year-olds that have premature ovarian failure. It's looking at the body as a whole and helping the body balance itself through these processes that we call hormones, that we call hormone imbalance. So one of the nice things for me with Chinese medicine is that I don't need to have a Western diagnosis. I don't need to know. It's nice to know. And I do have I'm a doctor of Chinese medicine. We do a lot of Western medicine in our studies, but I don't actually practice Western medicine. So, but I like to know those things, but it doesn't always have to matter. Is there a fibroid? Is there PCOS? Is there endometriosis? Those things are good to know. It's good to know where the patient's coming from, but our treatment is all about balancing the body and helping the body move through those times and those, figuring out why is the body reacting in a goofy way and how are we going to help it move through that.
Love it. Ariel, do you have anything to add?
I think I would absolutely agree with what Jetta is saying. We want to figure it out. When our body starts acting strangely, we go into survival mode and it's like, here's a problem that I have to solve. And so we're looking for that diagnosis or those tests or something else that will confirm what is actually wrong with us. And so what if there was an alternative? What if there's nothing wrong with us necessarily? We just need to find ways to better balance the body so that we can go through this natural transition with as much ease as possible.
I love it. And since the word tests has been brought up, let's talk about what are some of the tests that are available and what are your thoughts about those tests? Ariel, why don't you continue on with that and talk about tests?
Okay, so what I will add there is, yes, when we start to experience these symptoms that are very problematic and that are affecting our day-to-day life or our health, I think it's important to go to your medical practitioner or your GP and maybe get some tests for your follicle stimulating hormone or your estrogen levels, just to see where your body is at, and then move along from there. However, when it comes to the more specific testing, I think that can be very valuable and useful if you've already decided to do some bioidentical hormone replacement therapy, whether that is synthetic or more natural. But that's probably where I would look at getting more of those specific numbers. Otherwise, it's so much more about looking at the body and really, as we talked about, being our own advocate, becoming empowered in how the body is functioning, and checking in with, how is my digestion? What's that like? If I paid attention to my gut, is my gut healthy or is it not so healthy? If I started to notice we're talking about everything else here, but if you turn around and have a look in the toilet after you go number 2, what does that look like? Does that look healthy, or are there some improvements that we could make there? How's the health of my glandular system otherwise, my liver? So these are some things that I would check in with the help of a practitioner, but I wouldn't necessarily run out and buy any of the standard tests that are available online personally to get any of these numbers, because how are those numbers really going to help you other than just provide you with a baseline that you can already feel qualitatively in your body?
Thank you. Thank you. And Neelima, I can just feel you bursting to say something. Please jump in.
I just love how Ariel led that. I'm probably a very unusual doctor in India, and it's like there's the rush to do medical tests, and there's been a sprouting of diagnostic centers, and you can order a test, online and get a battery of 78 tests for, half the price. And I think people all around the world, ever since the word hormone became fashionable, they've jumped onto this bandwagon of getting tested. And the truth is that you don't need, whether it's Dutch or American or French or Chinese or whatever, you don't need, somebody's named tests to decide what problems you're having. Some of the scores that I use for menopausal women, the menopause rating scale, there's so many of them, they're symptom-based. They're not based on blood tests. Yeah, there are some tests I recommend, but not before a conversational assessment, not before doing a menopause rating scale, not before I actually determine how is this woman's quality of life being affected. Because there's some things I know beyond quality of life that the woman needs that she's not going to be willing to hear just because I said so. That's when the testing becomes important. When I start talking about cardiometabolic risks, when I start talking about Alzheimer's disease, when I start talking about osteoporosis, I start talking about the risk of heart disease, the risk of getting a heart attack. When I start talking about irregular periods causing, endometrial problems or the risk of cancer or breast disease, then I need something a bit more solid than just my word for it. So then my testing is based on the evaluation of the person sitting in front of me, and in India particularly, their economic capability, what their family thinks, and what they're going to do with the test reports. So I don't order tests, blanket tests. It doesn't work. I don't think so.
Thank you. Jetta, do you have anything to add to this?
Yep. I have to sort of ditto what you two said. And then my practices, the type of treatments that I do are all sign and symptom based. So they're not based on tests. I do a lot of fertility work and hormone work. So often there are tests that are run, and I work with naturopaths that run tests, and I always find it interesting, but it really has no bearing on how I treat the patient. So, and the one thing that I find is when we rely too much on tests, we end up treating a lab rather than a human. So it's, I don't know. I do find data interesting, but I don't know how much it really serves it doesn't really serve my treatment. So yeah.
Oh, got it. Fascinating discussion around tests. And we're going to move into another question, and it's what are essential questions women need to ask their healthcare practitioners when they make appointments? But just before we get to answering that, I think everybody should take a stretch break and get some energy going, whatever that means to you. Just move in your chair. We've been sitting. If you want to stand up and do that, that's cool too. Get some energy. Move your head around. We should make a practice of this. I know I need to do it more when I'm sitting at my desk.
Chair yoga.
What?
Chair yoga.
That's right. Chair yoga, stretch back, stretch forward, side stretches. Whew, okay, and let's come back to this. So, essential questions, and people, if you want to get your pen and paper or type it into a document, this might be the moment for that. What should every woman who's going to have a healthcare practitioner appointment about their hormones, what are the questions they need to ask? Jenna, since you were talking, let's just start with you.
Yeah, so this is kind of a like coming from Chinese medicine. I keep saying this, it's a different practice than allopathic medicine, and it sounds like it's what I'm doing is kind of similar to what you two are doing in terms of you're actually looking at the patient and what's happening with them. I have patients that some of my pet peeves, actually, I have patients that come to me and they say, oh, I'm taking this hormone and that, and I say, well, how much of that, and how does your practitioner know? Oh, I don't know, they just gave it to me. Did they base that on anything? And are they following up? Oh yeah, I have a follow-up in 6 months. And I'm like, did you ask them if they've ever done any education in giving hormones, or if they have any experience, or what their experience is? And I find in Canada it's a little tough because it's hard enough to get a GP as it is, so you kind of take what you can get. I think if you're going to be working with someone who's giving you hormones and providing that type of care, you want to make sure they actually have some kind of education and experience in it. When working with someone that does what I do, you may want to ask things like, how much experience do you have working with patients with my condition? What type of treatments do you do? How often do I need to see you? What is my treatment plan? What is my treatment plan going to look like long term? What kinds of things am I going to be expected to do at home? Is there lifestyle recommendations that you can make for me? Those types of things.
Thank you. Ariel.
Hey, I'm going to go a little bit rogue here just because I'm pretty riled up about the Canadian healthcare system right now in particular. And just the number of people who don't have access to a doctor. So what I'm going to say is, even before you go to a medical doctor, which can be important, but if you're experiencing things like headaches, or you have fatigue, if you are having issues with your mood, if your libido is low, vaginal dryness, any of these sorts of things, how's your diet? How much water are you drinking? Right? A lot of these things we can really just be honest with ourselves and say, are we looking to treat the symptoms of our illness with a pill or something magical that will maybe help that to go away? Or are there actions that we can take at home right now which will help us feel better? So I really recommend being honest with ourselves if we're experiencing those symptoms to begin with, and then say, okay, so could I be drinking more water? Could I manage to go to bed a little bit earlier rather than scrolling on my phone? Or could I take that extra time to do some deep breathing and drink a relaxing tea before bed, which might help me get that extra hour or so of sleep before I maybe wake up with those sweats or any kind of discomfort? So really finding that self-empowerment first, and maybe talking to someone about the diet and things that we can eat, and maybe things that we want to take a break from for the time being, so that as we're waiting to see a doctor, we can start to feel better.
I love it. Neelima, I'm sure you have some things to say on this as well.
I would repeat everything that Jeda said and Ariel said, because, as I know how poor care can be, even as a doctor, getting the care you need can be a real struggle. And I was a gynecologist going through menopause and chronic pain and disability, and I didn't get the help I needed until I found it for myself. And it took a very long time to study it and apply it. So you got to have some shortcuts in your pocket. You don't want to have to study everything to be able to find the right person. So finding the right physician is really important, and give yourself the opportunity to go and test if you have that. And in countries like the UK, it's really difficult because once you get a GP, you're pretty much stuck until that person refers you to a hospital. But in places like India and maybe in Canada and the US, it's easier. You need to go shopping. And I don't mean that in a wrong way or a mean way towards physicians. But no, we know that physicians are not created equal. Even gynecologists are not created equal. Not every gynecologist understands or wants to know enough about menopause or sexual health to be able to help that class of women, because menopause, and okay, now they're becoming an economic majority, but for the longest time, menopause has been a Cinderella specialty. Nobody wants to be dealing with old women. They kind of lost cause. Exactly what Ariel said, the disappearing crowd. And you don't want to be that. So in order to be seen, you also need to empower yourself to go shopping. Go and meet more than one physician and see, test the stuff you share. What kind of reaction do you get? Do you meet somebody who's open, who's willing to talk about your sexual needs? Is there somebody who's willing to listen to you about are they willing to give you time? If they want you out of the door in 6 minutes, then find another one. Because a menopause consultation in my clinic can last anywhere between 45 minutes to an hour and a half, depending on what unfolds. Sometimes you need more than one appointment to kind of figure out, because some things need evaluating, some things need assessing. You need to send somebody away with some questionnaires and assessments and make some shifts in lifestyle before you start to feel different. Definitely go with the physician who encourages lifestyle changes. So like Ariel said, a physician actually asks you, are you sleeping? What's your sleep like? What's your poop like? What's your pee like? Do you leak? What's your sex life like? What's your libido like? What's your desire like? Do you have a great relationship? How's your life with your partner? How do you react when your teenage kids start to behave? Do you lose your temper really quickly? Well, what's happening down there? You dry. So, somebody who's actually willing to listen to you talk about all these issues, talk about the pain that you're going through, maybe emotional pain, physical pain. And if somebody's not willing to listen or even be non-judgmental about it, not willing to just suddenly jump in and start giving you advice, then you need to look for somebody else. And I would persevere. It can take you up to seeing 6 people. So 6 is your limit. So keep looking. And also, it's really important that as a physician, physicians are terribly judgmental many times, but you don't judge them back. They're just ignorant. Yeah, because they've not gone through it. I don't mean it in a mean way. We're very well intentioned. They want to help. They want to care. But sometimes they just don't know what they don't know. Like I didn't know what I didn't know until I went through it.
Yeah.
Until I learned how to fix it. Until I learned, to look at myself with compassion. And that journey is ongoing. It doesn't finish. So as you exercise self-compassion, be compassionate with the physician that you didn't like.
Can I add one thing? It's not that easy to find sometimes, and especially in our type of healthcare system. But if your doctor shames you for seeing other healthcare practitioners that are helping you, that's not helping you.
I totally agree, Jetta. And I have my own story in 2022. I had to go through a whole process with a gynecologist, and it was a guy. And I wanted to find a woman, but it was an emergency, and this was the only person available. And so I went with it. I wish I'd had this information before, and I would have said, no, I'm just going to wait. Thanks. And in Canada, 6 million of our very small population do not have medical doctors, and 1 million people in British Columbia do not have medical doctors. So despite that, I would still say that we need to listen to your advice and be picky. And if the first doctor is not supportive, don't just shrug our shoulders and go, okay, well, that's what I've got. I don't know, but I'm going to stay the course. You beautiful women are encouraging me. If I have some issues, I'm going to find the right person for sure. And now I have, of course, you three in my corner.
The right person isn't always just the one who agrees with you. The
No.
right
That's
person
true.
is also the
No.
one who's willing to tell you stuff that you didn't want to hear.
Yeah.
Go
And
ahead, Jenna.
just one tip, nurse practitioners are starting to be the ones I think that I'm starting to refer to nurse practitioners versus GPs and specialists, because I can actually have a relationship with a nurse practitioner, a conversation and that type of thing. So
Ariel, you were going to say something as well.
I just so much agree. They have so much wisdom, so much knowledge and experience, and empathy, I think is the main thing.
Excellent. I know that's something I'm going to look around for as well. And we've skirted around the issue, but let's talk about painful sex right now, because we promised the people on our advertising that we were going to talk about that. So let's dive into what that's all about. Why is sex painful? Why are our labia? And I've got this beautiful picture of, of vulva here that my partner has painted, the Origin series. What happens with our genitals and our whole system and hormones that makes this such an issue? Ariel, why don't you start?
Okay, so at its essence, and it's very complicated, but as estrogen levels naturally decline, it causes a cascade of different effects, and that can affect the tissues and the secretions of the vagina and surrounding area. So from my perspective, what I do to support my clients is, again, really work on digestion, improving the gut biome so that that area is really healthy, that we are digesting and assimilating our food properly is so important, so that we can actually get the nutrients that we need out of the food that we're eating, especially those healthy fats, which are going to be very supportive, the right kinds of amino acids. And if we're choosing to eat foods that have phytoestrogens in them, basically plants that naturally contain their own estrogens, that when we eat, they can maybe give us a little bit of a boost, that we can get a good array of that into the system. And also when estrogen tends to go down, we might also be more inclined to experience more yeast infections, UTIs, things like that, which can decrease our sexual confidence. So having a nice healthy gut will also decrease our chances of those kinds of things happening. And that will help us overall. Taking it back to basics, lots of hydration is really important, not just water, but that the water that we're drinking is living water, that it contains a good amount of naturally occurring minerals so that we get all of the electrolytes that we need, and that water can actually pass into the cells and plump them up. That's going to be really important. And that we're getting a lot of fiber from fruits and vegetables, not just for the good bacteria of the gut to be munching away on, but when we have enough hydration and fiber circulating through the bloodstream, it helps to pick up on any of the excess hormones that may be circulating in the system and causing some of our mood swings or some of the other symptoms that we are experiencing, and help them to flush out of the system, which is definitely something that we want. And that hydration and fiber is also going to ensure that the liver stays nice and healthy so that it is better able to regulate the hormones that we do have. So those would be my primary recommendations from the root level. Take care of your body well, and then allow the body to do what it knows how to do, which is recover and heal itself.
Thank you, Ariel. Neelima.
With painful sex, and I'm presuming this is, we're talking only menopause, because painful sex happens for many different reasons. If we consider menopause, like Ariel said, it's decreasing estrogen levels. But what we know from research is that the vagina, particularly, compared to all the other, like hot flushes will come and go. You might find that your joint aches, pains come and go. And as you settle down into menopause, the mood swings tend to settle down. One problem with the vagina is that it does shrink. It doesn't matter what you do, it's going to shrink, it's going to flatten out, and it's going to narrow. And it's not just the dryness that makes sex painful. It's the fact that women have wired themselves to think that, oh, now I'm menopausal, I don't need sex. Once my kids are, I don't need sex. And then they abstain from sex because they think that their libido's gone down. Yes, libido does go down, but libido and desire are two different things. I talk about this quite a lot. You can still desire intimacy, closeness, appreciation, and love from your partner. Your libido may crash, okay? But wanting connection and sex is just the next step in a conversation. That's really, really good. When you have regular sex, the vagina does, and because the pelvic floor gets exercised, the vagina stays much more flexible, much more vascularized, it stays better hydrated, even without estrogen. But as you go further down the line, without estrogen, that vagina is going to gradually become thinner and thinner and thinner and less vascular and less lubricated. And the result of that is it becomes more drier and much more painful. It tears more easily. It's much more likely to get infected. And because the receptors of estrogen are present all around the bladder and the base of the urethra as well, you end up getting recurrent urinary tract infections. You're much more likely to have chronic, pelvic congestion, because the pelvic floor muscles have become weak now. So they don't respond, they don't contract and relax as well to get rid of some of the congestions experienced with arousal. So all of this is like tied in with each other. What I would suggest, if you're having pain, is to remember, as long as it isn't something else, like it's just dryness, vaginal dryness, and you're pretty sure it's just because it's dry and papery thin, then number one, don't deny yourself the pleasure of sex. You need it as much as the person you're with. Regular sex. If you don't have a partner, then find a way to use a vibrator or something with lots of lubricant. And lubricant for menopausal vaginas are pH balanced, because as you go through menopause and estrogen declines, the pH of the vagina changes, because the cells of the vagina no longer have the glycogen that they would normally have when you're producing estrogen. So the bacterial colonies in the vagina change. Yes, you have a vaginal microbiome as well, just like you've got a gut microbiome. And as this microbiome changes, the pH of the vagina changes. So the lubricants and the moisturizers you use for the vagina need to be pH balanced, so that they make it a little bit more acidic, for the vagina to start becoming more resilient, more hydrated, and more rugose again. For sure, practice having orgasms. Orgasms are really, really, really important for restoring hormone balance.
Let's all give it a hand. Orgasms for everybody. Have lots of orgasms. Okay, excellent. Carry on, Neelima.
You need your vagina as you get older. I goofed up once on Instagram because I said the vagina needs regular stretching, and I got a whole ton of messages saying, "What are you talking about?" Not the women in reproductive age group, not those who had, just had a baby. But as you're going through menopause, the vagina does need working out at least once a week. At least once a week. You will find that if you have sex or you don't exercise your vagina less than once a week, and you leave it and you then have it after 2 weeks, it's just that little bit more uncomfortable to get started again. But if you're having sex at least once a week or twice a week, then your vagina will remain better lubricated and better stretched to be able to tolerate it the next time. Also, if you haven't had sex for a very long time, you get yourself acclimatized to it. Have the orgasms, use the lubricant, use the vibrator, and expect that the first time you have sex, if you're in a new relationship at menopause, it is going to be a little bit uncomfortable, but do persevere with it. It helps if you've got a really, really understanding and caring and gentle partner. It helps. And one of the most shocking things that women come to me with is that, oh my God, I bled after sex, and it's so sore and painful. Whatever you do, don't apply some ordinary moisturizer cream, because that will sting and burn. And I know many, many menopausal women who've gone and reached out for some cream that's on the bedside table that they would apply to their face and stuck it down there and hollered with pain because it burned and stank. Okay, so be careful what you put down there. That area is really very gentle, very delicate. It's not as strong as your face is, so face creams don't work down well. The best thing you can reach for is pure, ordinary, simple coconut oil or pure, simple olive oil. That works as a soothing balm a lot better than some sort of cream of that. Be careful with aloe vera gel as well, because that can sting. I'm kind of losing my track. I'll come back.
We'll come back to you, Neelima, and we have some Q&As that I'm sure we're going to go down this. Jenna,
Yeah.
do you want to comment on anything to do with paid?
I don't know. I think Neelima summed it all up.
Okay.
Use it or lose it. Use it or lose it, and take care.
Okay, awesome. All right. Well, and what are our body cues to listen to when all in this whole conversation? What should we be paying attention to? I know you've referred to it. Jenna, why don't you start us off? What should we really be paying attention to in this time of our lives? What should we be looking for from our bodies?
It's looking at how the changes that happen in our bodies with all of the processes, our digestion, our sleep, our moods, even how our bodies sweat or don't sweat. How often do we get our heart rates up? Are we still moving as much? You know, one of the simple things I tell people, even, you know, when you think about children are active and they do a lot of things. We say in Chinese medicine, we say children are mostly yang and a little bit of yin. And as we age, we're more yin and less yang. And we need to move and practice using our yang to keep it. And yang is the life force and our energy. But when we notice that things shift and symptoms might even seem weird. I've had people say, oh, I have these weird hot flashes in my lower legs, and they don't even want to mention it because they feel like it's a weird thing. And it's no, it's what you're experiencing. So what are you experiencing, and how is that affecting your daily life? Things you may think are not even related in terms of the processes of our body.
I love it. Ariel? You're muted.
You're mute.
You're muted. There you go.
So much echoing the wisdom and knowledge that's being shared, really just highlighting that the message that we're given as women as we age is that we are not as important, that we should be fading into the background, that we should be putting our energy into the younger generations of people in our family or in our community. And so there's very much this that we tend to, this is what I'm hearing so much from my clients, that we tend to start ignoring our own bodies, or because we feel that our bodies have betrayed us or abandoned us, we have anger towards our bodies. And so we don't take care of them well, or we don't want to look at them. And so we tend to ignore the earlier signs of imbalance. And it's really only when the body starts screaming at us that we have to respond, because it's so much getting in the way of our day-to-day. And so I would really just encourage anyone who has that inkling, that gut feeling, something's off with me, I'm not sure exactly what it is, I may be starting to go through this change, maybe I should start seeking out support or resources. Obviously, everyone here, you're there, you came to listen to us and to get engaged, and that's fabulous. But that's what I would say, is just start having that dialogue, that conversation with your body, and become more attuned to the subtle messages that you're getting and the rhythms and the cycle of your body. And even just that will make such a difference.
I love it. Neelima.
I'm going to come at this from a little of a preventive angle. Some of the major killers today are heart disease, breast cancer, bowel cancer, Alzheimer's disease, osteoporosis, and fractures. These are the major killers. And for most women, they don't even come into their radar. No, because it's always the other person, right? All this stuff happens to somebody else. It's not going to happen to me. But the truth is, all of these conditions are in the pot. They're forming for almost 2 decades before they actually manifest. Did you know, like for like, when a woman and a man go to a doctor with the same symptoms, the men get investigated, tested, and treated 4 times more often than a woman does. So women being discounted in healthcare is not a new thing. And if you're menopausal, you're more likely to face it, simply because women, A, they don't turn up to the doctors. They're more bothered about saving time, saving money. You know, their son's graduation is more important than that little twinge, you know, in the jaw that they had, or the constant breathlessness that they feel as they climb the stairs. You know, they'll ignore that because it's more important to attend the child's graduation than it is to go to the doctors and get an ECG. More women die of heart disease and heart attacks between the ages of 50 and 55 with the same symptoms, because they don't get the attention they need, because they haven't turned up. So for a woman, how does she know which symptoms are danger symptoms and which symptoms are just mild or bothersome, irritating, that you can just ignore? I covered this a lot more detail in the menopause course, but in physical symptoms, if you're somebody who's having very, very severe hot flushes and they just do not subside, you've done whatever you need to do, and it's 3 months. You give yourself 3 months to fix your lifestyle, go and see, you know, get whatever herbs you want to get, etc., and it's not responding. You need to go and get a heart focus checkup. We know that the severity of your hot flushes is directly correlated with your risk for heart disease as you go through menopause. If you're breathless and you have atypical symptoms like pain running up your jaw, you know, pain in your epigastrium, constant heartburn, belching, that's new. It's not something that you've had before. It's atypical. So you won't get the same heart attack symptoms that men will get. You won't get that crushing chest pain. You won't get the pain radiating down the arm. So heart attack symptoms in women are different. They're atypical. And women miss out on that and they don't reach the doctor on time. So it's really important that you also tell your family circle that if you ever find me getting dizzy, falling down, complaining of weird kind of pain, take me to the doctor. If you've got a family history of osteoporosis, you've got a mother who's bent over, or you have been on steroids for any kind of treatment, you drink a lot of coffee, you've had things like SLE or rheumatoid arthritis, etc., that's needed steroid treatments or other kind of treatments for a long time. If you've been mostly in a sedentary job, then you're at a higher risk of osteoporosis. So get yourself tested. If you're somebody who's had premature menopause, early menopause, needed surgery either for cancer or endometriosis or any of those other kind of conditions, or you've been on medication that causes decreased bone density, then you need evaluation and need treatment for that. Alzheimer's disease, again, if you've got a family history of Alzheimer's, if you've been high on grains, if you find your mental activity isn't as good, there are now better tests to screen for it. Because Alzheimer's is preventable, but it is not treatable. So it's really, really important to, if you feel that you're not completely okay, get tested, get assessed by the right person. Again, you might need to look around. So these are the main things. Cancers. If you find a breast lump, please don't go to a herbalist. Please don't go and look to some guru. Please don't sit and chant mantras. It doesn't go away. And your survival is determined by how quickly you catch a cancer. Every lump is a cancer unless proved otherwise. Breast lumps. If you see blood in the toilet and you don't know where it's coming from, whether it's coming from your bladder or your bowel, go immediately and get tested. Bowel cancer is one of the most common cancers that kill people across the world. Get a pap smear. If you have regular cervical cancer screening, then make sure you're on the cervical cancer screening list. If not, then make sure you go and get a regular pap smear, because that's the other thing that kills. In countries where cervical cancer screening is not the norm, countries like India, a woman dies of cervical cancer every 8 minutes.
Wow, Neelima, you could continue lecturing us, and this would be amazing. Thank you for sharing all of this. I look forward to learning from you some more in other contexts. Let's now open up the space to questions from our attendees. Raise your hand. To those of you who don't know, aren't familiar with Zoom, go to the reactions button at the bottom of your screen and raise your hand if you would like to ask a question. And while people are organizing that, Rusty, that's awesome. There were a number of questions that also came in from our surveys. Thank you so much for responding to that. But let's just go. Rusty, ask your question, please.
All right. Well, yes, orgasms. I have from chemotherapy put me into early menopause at 43, and after that, my vagina was very dry, and I tried a few things with lovers after that, and it was also very painful. The same kind of experiences that I had within my marriage that were psychologically induced then as well. Probably food, because I wasn't eating at all healthy in my 20s. But I do practice orgasms, but nothing internal. Like I have a battery operated boyfriend that does the job on the outside. So that's probably not the kind of practice you were thinking about. And I don't know if I'm ever going to be sexual with someone again. I'm going to be 63 this year. And I love what you said about libido and desire. But if I was to want to be sexual with penetration again, is there any hope?
Yep, there is. You need to start practicing now, though.
It's really difficult.
Because the longer you leave it, the longer you leave it. You know, it's not that it will never stretch, but make sure you get. And I don't know the reason for your early menopause. You said cancer and chemotherapy, but I don't know whether it should be okay for you to have estrogen or not. We know more and more now that vaginal estrogen does not affect even women with so-called estrogen-dependent breast cancer. So there's more research coming out now. But yes, vaginal estrogen is very, 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 very effective. Many doctors will not give it to you even if you ask for it because they don't know and they're afraid. That's okay. But at least use the vaginal moisturizers that are available in your country. So Replens is one, Balance Active is another one. You'll find a whole host. But you need to gradually build up. If you find that you buy a vibrator and you can't get it in, don't despair. There is a company called Ariel, and you can buy Ariel dilators. They're called dilators because a man invented them. Otherwise, they would be called accommodators if a woman had it. Does not need dilation. It's an amazing accommodator. So Ariel begins with a dilator that's the size of your little finger, and you can gradually kind of increase the size on your own without causing pain. Use plenty of lubricant and practice when you're relaxed. Because what does happen as you get older is that the pelvic floor muscles start to become spasmodic. So they forget how to contract and relax, and they kind of stay in one position. So it's really important to learn also that your pelvic floor muscles need a workout. Just like the rest of your muscles start to decrease, the same thing happens with pelvic floor muscles. So they need exercising as well. So you know how to contract and relax.
Mm-hmm. Oh, yeah, I can just contract and relax in there. But yes, okay. So maybe if you can put that in the chat, what kind of accommodator that was.
Yeah, that'd be great. And anything to add, Jetta, quickly, or Ariel?
No, I don't think so.
Okay, let's move on. Thank you, Rusty, for that question. Let's move to the next question. Carolyn, I think your name is. And unmute yourself, please.
Hello. Yeah, I had a question. About 4 years ago, I had estrogen positive, HER2 negative a lump in my breast. It was removed successfully. I did radiation a bit. But prior to that, in my 50s, I think my doctor, because I had vaginal dryness, he had suggested a progesterone cream, which I never used. But that's why I was wondering if you have estrogen positive cancer background, is it safe to use something, or what's safe to use?
That's a great question. Neelima, let's get you to answer that first as a gynecologist. Let's try there.
It's still not widely accepted that you can use estrogen in women who've had estrogen positive breast cancer. And a lot of doctors are still on the edge because there are some research papers say that yes, you can, and it doesn't really increase your risk of having recurrence. And there are other research papers that suggest that, well, there's no significant increase, because remember, breast cancer recurrence is not just determined on your estrogen production. It's also dependent on your physical activity, your obesity levels, on the diet, environment, toxins, etc. So the risk, I don't think the research is ever going to prove conclusively that you can have estrogen. You're much better off right now focusing on using a lubricant or a moisturizer that's made specifically for menopause, and either practicing with a vibrator or with these dilators if you don't have a partner to be sexual with.
Thank you. Jetta or Ariel?
That isn't really within my scope of practice to give advice about whether you should or shouldn't take estrogen, but the types of things that I help people with when they are experiencing sort of estrogen progesterone imbalances or lack of estrogen or that type of thing, or working with cancer patients, is just coming back to the idea that we're balancing the body and doing a lot of the lifestyle habits and those types of things to get your body into balance as much as you can. And as far as I mean, I have my own different opinions about different types of estrogen and the use of estrogen, but it's not part of my scope of practice to give advice whether you should or shouldn't take it, especially around cancer.
Okay.
Cancer.
Thank you. Ariel?
Ditto what Jetta
Okay.
there. Yes.
Awesome. So thank you for that question. That was great. I don't see any other hands, but there's a question in the chat. Are UTIs common during menopause, especially after sex, and how can it be avoided?
I'll just say quickly, yes, very common. I see them in women who aren't in menopausal years as well, earlier 30s, even 20s. Peeing before sex helps. And then doing a overall assessment on the body and saying, okay, what's happening with the bladder? What's happening with the kidney? In Chinese medicine, we're looking at kidney, bladder, meridian, sometimes liver. Sometimes it doesn't necessarily mean there's something wrong with that organ, but we're asking the body what's happening with the body that's causing the discomfort and the symptom to crop up, as well as drinking lots of water and working on the same ideas as getting blood flow and those types of circulation and things like that to the pelvic floor.
Thank you. Neelima, do you have anything to add to that?
There's a few things. You're more likely to get urinary tract infections because the tissues around the bladder and the urethra become thinner as you go through menopause because of decreasing estrogen levels. The second thing that often can happen if you have recurrent urinary tract infections is because when you have sex, it causes small tears and damage, especially if there's dryness and the vagina is becoming more friable and thin. Using a good lubricant and using vaginal estrogen is known to prevent recurrent urinary tract infections at menopause, and also to help with things like overactive bladder, which often kicks in as you go through menopause. The other thing that's really important that doesn't get talked about is sexually transmitted infections. If you see the world today, many women as they go through menopause are either widowed or divorced or separated, or just because of the liberal culture, they have more than one partner. Sexually transmitted infections are having a resurgence in the age group over 40, particularly in women, especially infections like chlamydia and gonorrhea. And these two are really important infections that often present with urinary symptoms. So it's important if you've had a change of partner, or you're in a new relationship, or you think that the person you're with has been in another relationship and you haven't both been tested, it's really important to get tested and rule out sexually transmitted infections. If you're in a new relationship, always use a condom and use plenty of lubricant. That one. And of course, the tip that Jetta said, you pee before and after sex. Also important is to clean from front to behind. it's important for perineal hygiene that you don't use your hand to clean from behind forward, because otherwise all the bacteria around the anus will go and populate the vulva, and then they get easy entry into the urethra. So these are just some tips.
Thank you very much. Lisa, I see your hand up. You want to unmute yourself? Thank you for coming on screen.
Oh, yes. Hi. This is just, first I want to say this has been so wonderful. So much knowledge. And I wanted to ask, I didn't hear you talk a lot about testosterone. So I've heard a lot about estrogen, and but what are your thoughts around, I know that our body also needs testosterone, and that's something that we can become depleted of later on in our years as well. So I just wanted to kind of hear, your thoughts about how do we learn more about that, and how do we really understand estrogen versus testosterone and all of that?
Great. Good question. Ariel, do you have anything to say on this?
Again, I would really just weigh in from the nutritional perspective. There's many things we can do to boost testosterone naturally in women. First thing that we want to do is really to ensure that we have the right nutrients to balance the adrenals, make the adrenals happy, to decrease our stress hormones. That's going to be so important. So I would speak specifically to making sure you're getting enough protein in your diet, that your digestion is really good so that you are absorbing that protein adequately. Making sure that you're getting enough healthy fats is really important. So are you getting a really high quality fish in your diet? Are you making sure that you are getting something like hemp hearts if you are more plant-based? And then some other ones would be magnesium or B vitamins and zinc specifically. So a whole foods diet would be really important to ensure that the whole glandular system is really well taken care of. And then the body will do what it knows how to do and balance itself out. This is where we can get a little bit from the allopathic method. This is my opinion, is we can get a little bit nitpicky with where is my level of this, my level of that, this, that. And I would say, fortunately, actually, the body is so dynamic. Everything is always changing and evolving. And so those numbers might be accurate when you get the test done, but then you might be at a different point in your cycle, or your life may have changed and things could be different a few weeks or months later. And so really, I would take it back to ensuring that you are well nourished, well rested, well hydrated, and then let the body do what it knows how to do.
Excellent. Jetta, do you want to weigh in quickly?
I agree with that too. And just the part about, I mean, when we think about our adrenals taking up the slack for the other, where the ovaries start to shrink as we go through menopause, and our adrenals do really have to pick up the slack. So we want to make sure they're healthy and getting the rest, keeping stress managed, eating really well, keeping active, doing weight-bearing exercises. I like to tell people to do a little bit of spinning too. Spinning is it's one thing we do as children that we stop doing as adults. If we're,
you mean spinning around in our bodies?
Yeah, like we stop spinning, like we stop turning. And then we get these sort of imbalances. And I think turning is important. I even tell people, when was the last time you did any kind of turning?
That's awesome. I love that. Thank you, Jetta. Neelima?
I love those things that Ariel and Jetta said. There is a hypothesis. It's called the cortisol steal hypothesis, where because you don't have the ovaries producing the testosterone. And remember, you only produce like less than 1/10 of what men produce. So you don't need a huge amount. Your adrenals are supplying that testosterone. Now, if you get stressed out for whatever reason, either it's because you're over-exercising, you're over-dieting, you're not sleeping well, or you're more worried about work, if you're like a corporate lady, then you're stressing out your adrenals. What happens is that the substrate, which is cholesterol, which is then diverted to manufacturing sex steroid hormones and cortisol and adrenaline and norepinephrine, gets diverted away to producing more stress hormones, and you have less substrate available to produce testosterone, progesterone, and estrogen. So that's why you experience a deficiency of testosterone in the form of dropping libido. Now, testosterone in women is not just important for libido, it also has really important metabolic functions. So your cardiometabolic state, your ability to maintain your muscle mass is really important. Testosterone, that depends on testosterone. You can work your body the other way around as well. So you can focus on building, like Jetta says, resistance exercises, but really building strong muscles, and that will feed into improving your testosterone levels. You can boost your oxytocin levels, which then balances out. You cannot have raised cortisol levels and oxytocin. So if you boost your oxytocin levels by, dancing, spinning, singing, having orgasms, great sex, communication, lots of skin touching, then you'll balance out your cortisol. And that makes a big difference. So, and of course, having great sex also boosts testosterone levels, because your brain's communicating and saying, I need more of that. That was amazing.
I love that. And Judy, I see your hand up, and I have some things that I want to share with all this group, and we'll get to your question after Judy, but I am going to do a quick screen share because this conversation has been so amazing. I have found so much value. How many of you have found value in this conversation? Yeah, raise your hands. Yes, I see that. And because it's been such an amazing response to this event, we've decided to add a second one. So I'm going to share my screen, and we're going to do I have an offer for you because this has been so phenomenal. The information from these women is amazing. We've decided to do part 2. We didn't even touch on hormone replacement therapy this time. So we have decided to do part 2 to this event on, it's called What the Hormone is Happening to Me, because this is our series, Redefining Menopause, Sex, and Body Image in Midlife. We will continue on in this discussion, and we will get down to some of the nitty-gritty things. We're going to talk about some social stigmas. We referred to those. We're going to define about the 3 different phases of menopause. Hot flashes, night sweats. We've talked a lot about vaginal dryness today, but we didn't even get into the night sweats and the heat and what we can do about it. And sexual intimacy. I think we need some more conversation around that. And certainly, what is HRT, BHRT? How does that work? What should we be doing about it? And we've talked about weight and weight management and body image and self-esteem, and most importantly, self-care and self-advocacy. So we're going to talk about those in our next conversation. So there are 2 ways that you can attend. We always want to have our information free and available to you, our valued community around the world. And so we will be live streaming the first 60 minutes for free to anybody who wants to attend on sorry, I said Zoom, it's YouTube. Or we will do the same thing that we're doing today, which is the interactive chat, the all participating on Zoom and having our Q&A session after. And if you decide to become a My Myself Insider today, there's an offer today. We'll be engaging together, chatting, the question and answer afterward. And we could charge $50 for this, but we're not. We're going to charge $15, like smoking hot deal, right? But there's bonuses. And first bonus that you get today, Doc Jetta has as you can see, a recipe and meal planning guide that's specifically addressed to thyroid health. And I checked it out. It's amazing. And instead of the $40 price tag, we are going to throw it in free to this $15 offer today. But wait, there's more. Bonus number 2, Dr. Neelima has a masterclass, Know Your Hormones. Would that not be a valuable thing for us to all attend and learn more about our hormones? Oh my goodness, I certainly would. It's February 18th, India time, but she's going to share the recording for 24 hours. That price tag is $50. And for those of you purchasing the $15 ticket today, that will be offered to you free. I know I'm going to be attending for sure. Then Ariel has submitted a Sweet Tooth Survivalist cookbook. And I don't know if any of you have experienced Ariel's recipes, but I sure have, and they're freaking awesome. her price tag on is $20 plus. It shall probably be 50, but we'll use her number. And it's probably a technology thing. It's 20 cents. So I can't put that in our offer here, but it's 20 cents if you participate with the code. And we're going to send you all this information after. And third, it's 3, but it's actually 4. Dr. Neelima has a Master Your Menopause course. And again, her price tag is $50. It probably should be $150. And we are going to draw from the people attending today who choose to purchase the $15 ticket for our next event. We're going to draw 5 spots for free participation in this amazing workshop. And you've heard her talk today. Oh my gosh, I'm going to be signing up for that one too. February 27th to March 3rd, 1 hour a day for 5 days. And again, the videos will be shared for 2 weeks. I don't know about you, but I think this is a smoking hot deal for 15 bucks, don't you? So we're going to go to our next slide here, and here are ways to stay engaged, both with this conversation and with this event. So to either go for the free YouTube live streaming or the interactive live Zoom Insider link, you can go to our landing page and you can register for $15, or if you scroll down just below that and it says, join the Mind Myself, get a Mind Myself newsletter, you can join our Mind Myself community and we will let you know about when the events are coming. So that link has access to both. We invite you to visit Mind Myself because there's so much information and we're just getting started, so it's going to continue to grow. And finally, on this bit of information, we have a Mind Myself community. We've chosen not to use the other social media platforms that you're familiar with because we didn't want to be censored and we wanted to create our own safe space to carry on conversations like we're having today, because we've had people register from all over the world and we want to keep these conversations started. So if you're interested, you can join the Mind Myself community. It's on a platform called Mighty Networks and it's a little bit different. And I suspect some of our practitioners are even going to come along and maybe answer some of your questions. But we invite you to do those things. And I know that Wendy in the chat is going to make this happen. Thank you, women. Let's everyone give our practitioners a huge hand. I know many of you are off screen, but a huge hand to each other and to, this has been unbelievably informative. We are so grateful that you have been here and shared your time, your wisdom, your compassion with us. And we look forward to our next session, of course. To the participants, please check out the practitioners' profiles on the Mind Myself website. And let's keep this conversation going. Feel free to join the Mind Myself community if you like, but whatever works for you, keep the conversations going and be kind to each other. And I want to end with 2 quotes. Getting older is inevitable, but feeling old is a choice. And here's another one. Aging is not lost youth, but a new stage of opportunity and strength. So let's all find our new opportunities and strength together. And we hope you join us for the next session. And we do all of this because you matter. Thank you.